Hi, I'm Peggy with Potato Patch Nutrition, and I am going to do another Q&A today. This question was posed to us through email, and it's concerning a horse that has EPM. And this is what she says. Hi, Peggy. She says, hi, Peggy. I've been giving wormless to my gelding Stormy for 3 weeks. He had a rough past few months with 2 moves between boarding facilities and has lost some weight, top line, and generally not shedding out like he should. Also, he is spooky, which is unlike him. I wormed him 2 times with pace and treated for ulcers with some improvement, but he always just regresses after we stopped ulcer meds. Also, I hope that if he had parasites or if he was having a Lyme or EPM flare-up, wormless would kick it in the butt. We already know that he has been exposed to both. I've been giving the standard 1 scoop per day, split into 2 feedings, half morning, half night. Maybe 2 weeks in, I started noticing a slight unsoundness in the right stifle. When 3 days ago, he began to trip when changing direction at a walk and seemed to struggle going uphill with his stifles, and so wasn't really resisting the sideways pull on the narrow tail test either. Am I correct that most likely it is a die-off reaction to EPM? Can the wormless be given alongside anti-protozoal drugs, or would it be fine on its own? How long should I expect the die-off reaction to last, and how long should he stay on wormless? Thanks for your help. So, a few things to know about EPM is it is a worm, it goes beyond the blood-brain barrier, and that is where it does its damage and why it can affect so many different areas of the spine. Most commonly, you see it as a hind end unsoundness, but it actually can be as strange as I've seen it make a horse unable to swallow. And so it can affect actually any motor skill or anything that the brain is in charge of, because once it gets past the blood-brain barrier, it can just gnaw away at whatever it likes, and it generally has a very detrimental effect to things along the spinal column. I've even seen a horse be very unsound in the front and cross its front legs pretty much all the time, which was very odd. So it can present as a lot of different things. One of the difficult things, if you add stress to a horse that already is having a flare-up, and a flare-up is just essentially that the parasite has gotten past what the immune system can handle. And if you add stress, such as a move of stables, change of environment, change of friends even, it can be as simple as moving a friend of its outside or where he's not with that friend of his anymore. They're very sensitive to those type of things. Go to a horse show or a performance of some kind when their system is already under stress. The immune system is going to take a significant hit when something of that nature happens, and they're going to have a really hard time getting ahead of it. So it isn't only about being able to worm them, and we use a product called Wormless, which is all natural, it's all herbal, and it's actually able to get a lot of the parasites and some of the ones beyond the blood-brain barrier with the assistance of the immune system. Without the immune system being online, it's going to be very difficult for any animal to be able to do that. So our EPM protocol is actually a 90-day protocol because it takes that long to really eradicate, and I'm talking about mild cases, it really takes that long to eradicate enough of the parasites and bring the immune system online enough that it can then deal with them going forward. Horses are designed to be able to deal with the EPM parasite without a lot of trouble, but the environment stresses, changes, some of the things that we ask of them, moving them, the extra things that can stress them are going to be difficult on a high shedder. And high shedders, as we know, they just have a hard time with parasites in general. And so since the EPM parasite is not something that is affected by any of our conventional wormers, it can get ahead of the horse, and it's going to take more than 90 days to turn that around. I've seen it take as long as 6 months to really get the horse back to a very healthy place and able to deal with the parasite then in a natural way with the immune system. The Parasite has a 3 to 5 week gestation period, so it is continually hatching. And so to just treat them for 30 days really isn't going to get you very far. And we have and do use some of the conventional products. My favorite one is actually Prohibit, which is a very safe sheep, goat and cattle wormer that you can actually get on Amazon. It's called Prohibit, and Levamisol is actually the name of the actual product, but Prohibit is just the brand of it that I use. If anybody has a question about that, please just put a link in the comments, put in the comments or something, and I will link that one that I get on Amazon and describe how to use it. But so for a very severe case, we'll actually use Levamisol because it will get the ones that are loose in the system. It's a chemical though, so it's not going to go beyond the blood-brain barrier. And so we have a full protocol for 90 days. It has wormless daily because they do need nutrition. The body needs nutrition in order to fight anything. And then it also has kidney and bladder protection herbs. It has the full immune boost herbs in it. And we also suggest DMSO. So our kit comes with DMSO. And DMSO is a natural garlic derivative and is a very, very good anti-inflammatory. This particular horse, we did sent the 90-day protocol, and I'll put pictures towards the end of this video where she showed a picture of him when he started, and then I believe it's at 28 days, and there is a significant improvement, and the horse is sound now. But also he had a tummy issue, so we also did Tum Tum for that because he was suffering from ulcers, and it could just essentially just be the stress. Some of the things about EPM that a lot of people don't realize is that it actually causes a horse to have a lot of anxiety. So a change in attitude actually can be a very strong indicator that a horse is having a problem with EPM. Not always. There are other contributing factors to anxiety, but that can be a very telltale thing if you're seeing a little bit of unsoundness or just some weird movement that's not common, not normal for that horse. And anxiety, that those two combined, I would definitely get the horse neurologically tested. The wormless is going to eradicate the majority of the parasites, including the ones going beyond the blood-brain barrier that are throughout the body. The immune boosting system has 2 mushrooms specifically that worm beyond the blood-brain barrier. They're actually for the brain. And then it also has 2 amino acids that are not produced by the body, but are needed in order to clean the soup that the brain basically swims in. Because a lot of those parasites dying are going to get pushed out into the soup to be picked up by the body and taken out by the lymphatic system. And so those things that are in it specifically for this type of treatment. EPM is not a disease, it is just a parasite. And it actually is not that difficult to treat. And a horse doesn't have to suffer for the rest of its life with it. It doesn't have to not do the job that you and it love doing together. It can be healthy. And so if you have questions about this further or concerns, feel free always to reach out to me through email or text or messenger. And we would love to help you. Be blessed.